Well, thank you for taking the time. What I thought I'd do, I'm Steve Klein from Joint Fiscal, and I thought I'd just start off by going over the newest federal relief bill, the one that was passed, signed into law, I think December 31st, and where we are on understanding that, and then move back to the CRF bill, how those two interact, and then close with maybe like 3:30 or a few minutes either way. And just to give you a sense of where we are with the revenue forecasting, which is going to come up soon. We're expecting to have the new forecast on January 19th. So, and we've had a very the first 6 months have been pretty dramatic as far as revenue. So that's going to affect the world you operate in. So the first document I was going to go over is basically a fiscal note that Stephanie and I worked on about this relief bill, and it's primarily just how it fits into the world you're going to be living with. One is like the earlier CARES funding. It's tremendous amount we don't know. It just passed. The impacts are going to unfold. As of yesterday, I thought we had 210 million for testing and mitigation and for vaccines, and it turns out the number is now around 50 million. So there's 50? A lot of corrections going on. We're going to get new numbers later today, but this is sort of the brief as it stands as of last night, and then we'll talk about that. The bill that we passed was coupled with the FY21 federal budget. So the bill has two major components, and there's things happening in both of those. We're going to focus on the relief portion of the CARES relief portion, but and one of the documents linked to this fiscal note is the FY21 budget, and there's more money in that one for clean water. There's more money for broadband, and so I imagine the agencies are starting to wade through that and see how that'll affect resources. So we may learn more about that in the big bill. I mean, one example and things are just happening all the time. One of the things that happened yesterday or the day before was that one of the things which helped us is we've been getting more money from the Medicaid match. We've been getting a supplemental match for during this period of COVID, and so that's about 22 million a quarter. And we just had that extended through the quarter that ends on June 30th. So given we have one more quarter than we thought we were going to get, there's another 22 million, which helps our budget situation. And it could go further than that.
Steve, could I ask you a question?
Yeah.
Originally, we were getting that bump in the match for any quarter, even if it was the first week, for any quarter for which there was the federal emergency declaration was in effect.
Right.
Is that still?
Yeah, that's the general underlying law. But I guess what I understand from Sarah Clark is we got notified yesterday that they were definitely extending it through June 30th.
So we know that much, and it could be longer then.
Could be longer.
Yeah. Okay.
And so that's a good piece for us. And so one of the problems is this is going to keep unfolding throughout the session. So we're dealing with a relief bill that passed now. You're going to be learning about the money. The House is going to hear their budget adjustment from the administration on tomorrow afternoon. But my sense is there'll be more money coming in throughout that process.
I'm sorry to interrupt you. Then they are presenting it tomorrow.
They're presenting a piece of it, and because what they're going to do is part of the budget adjustment is just things, and this could change, but it's stuff like A&R needs more money to cover refunds and the small stuff. But I wouldn't be surprised to see the budget adjustment come in stages. Some of it be part of the bill presentation, because when you think of the budget adjustment, there's probably 0 to 5 million of just normal budget adjustment stuff. And then when you have a general fund budget that's growing by, I want to say $180 million of more money, that's a big deal. And so that would be technically budget adjustment. And so you may see that later.
I see. Okay. The reason I ask is simply for one of scheduling. So I think what you're saying then is Thursday afternoon, we ought to be prepared then to get that first.
That'd be a good idea. Yeah. Okay. To have Adam come in and present that.
All right. Thank you.
Okay, great. So the next thing, the relief bill extended, one of the things it did, it extended the time for using the CRF money. So till December 31st, 2021. So if you remember last year, we had this issue where so many things we couldn't fund because that was time limited, like in the area of housing or the area of broadband. And so now with an extra year, one of the problems is how much money is left. And, it may be in the $10 to $30 million range, but there still is the capacity to use some of the CRF money in a different way. And what's really interesting about that is it's not just this 10 to 30. You may have, we're going to have to talk about in a minute about the relationship. Like one example is there was 12 or 13 million left in the education world. So you're going to say, does that money need to stay in education? And maybe we know more today than we did 2 weeks ago because of all the new federal money and the change in revenue forecast. Maybe that'll be freed up for something else. So you're going to be moving money around. It's going to be affected by this new bill, and it's going to be affected by revenues. So, but that time gives you some flexibility. And I think that's one of the questions is how that happens, like how much of it happens with appropriations, because it's not like the past where you have this big new 1.25 billion, you have little balkanized money in different areas. May happen to appropriations, but what role do the policy committees play will be a thing to figure out. So then
I have a question to committee members, and Joyce Manchester did a summary listing.
Yep.
And do committee members all have that? If not, they should be sent because it has everything from what is there. But it sounds like it's changing. I'm not sure, Steve, but it included. So if you could send out the most recent one of that, showing the different categories, because K through 12 had a big slug. It was almost 130 million. There was money for, as you said, vaccines and tracing, et cetera, but that now seems to be less. So committee members ought to have the benefit of at least how that money, and then of course a big chunk of it goes out through UI and not through the budget process. So
and that's there's a link to it on this document. So we can have Chrissy could pull up the link and send it to everybody, so you would have that. And we updated that last night too. So that'll be good. But the dilemma is we think we're going to get new numbers tomorrow. So it may get, you may look, if you look at the date, it'll now say January 11th, but you might want to, if you wait a day and it says January 12th, you might have a slightly different number.
Okay. Yes, Rich, I hear Rich.
So does that, because from what I've seen so far, we get the broad numbers and we get the area, but there's different levels of flexibility in these different categories they've got. Is that all in there now so I can better understand if we have any flexibility?
No.
In some areas it is. Like we now have like 2 areas where we put in the most recent update on the renter subsidy. You'll see a document in there that explains how little flexibility we have. The other thing we learned in the last.
So what did you just say?
I said in the renter subsidy money, 200 million. If you go to our webpage in this area, you'll see it'll say right there what the renter subsidy money can be used for. And there's a fairly detailed document. It turns out the money for higher ed has already been allocated. And so we now have, and I can flip to that.
No, let's keep going through.
Let's keep going through this.
We have those allocations. Okay, so the next thing is just on this piece, the total relief bill. We're assessing it between 1.4 to 2.5 billion dollars impact in Vermont. The old relief bill was about 5 billion. So of that, and just to give the big picture of how that money is, about 600 million to 650 million. We're going to go over in this bill and talk about where that is. As you mentioned, there's the UI money and the money to the individuals that are going out in checks. That totals about 700 million or so, just those two. And then unlike the PPP money, the new PPP, and there's also money to help cultural institutions, art institutions, performance halls, a lot of smaller businesses that are in the arts and culture area. That'll be through the SBA. And so one of the questions that comes up, and it might be worth talking to the ACCD about, is how are they promoting that? How are they making sure all these businesses know to go to SBA and make sure to take as much as that as they can? Because it's not like we control how much come to Vermont. All we can do is encourage businesses to make requests in those two sources. So that'll be an issue. So that's that's why, while 1.4 might be what we're talking about between checks and UI and this money, the added money up to 2.5 could be this money for business assistance. And there are some things we don't know yet. Like we know there's some money for broadband, supplemental money to help people pay their bills. And we just haven't seen the dollars on that yet. So again, next, switching down, unless there's questions, I'll keep going. The guidance is really going to be tough. Right now, guidance is being written by the Treasury and by other entities under the Trump administration. In a few days, it'll be the early Biden administration. And then we fully expect another relief bill. And if there is another relief bill, it would be very likely to change some of the requirements and restrictions that are in this bill. So it's going to be a moving target. You will, if they do another check to people, or make, some talk about moving it back up to 2,000, that can affect your revenues. It can affect the, there's lots of pieces that I think it'll be one of those years where being in the Senate on the budget side may be easier than having been in the House or the governor, just because you're going to see an unfolding of money. And we have this really unique period where the Senate, in the Senate, the Appropriations Committee chair will be Leahy and the Budget Committee chair will be Sanders. So we have a very strong delegation in Washington on the Senate side. So just to give you a sense, the rental assistance, one of the things you probably remember is the money we got from the KRF fund. We got 1.25 billion, which was a small state minimum. And so that was about $2,000 per person in Vermont. Whereas New York, California, Texas all got $389 per person. 1/5 of the amount Vermont got on a per capita basis. Well, the rental assistance money was designed to be distributed exactly how the CRF money is. So we're getting a much higher per capita share than most states. One of the issues with that is that you have to obligate it by September 30th, or it goes back to other states to use. So, and the other problem is that's going to be really restricted money. And you click on that when you get this document, the rental assistance will give you the guidelines. It's for low income renters. There's no money in there for bricks and mortar. So one of the questions we'll have to think about is, do you take some of the extra CRF money and marry it to this to sort of help create some of the units then you can provide rental assistance for? Or can we get creative with that money? Can you use it to cover rental assistance provided through CRF and free up money? Or
there's an interesting word, directly or indirectly impacted by COVID.
Right.
And so
Right.
indirectly could, for those of us with expansive imaginations, can make a lot of indirect connections.
Yeah,
Figure that out, yeah.
this is an issue which you're going to have to talk with the administration about, because I agree, you can be pretty creative with this, but the administration will say it depends on your risk tolerance. And, because they'll say, well, if you really go by the book, you can't do much with it. But, we're in a really strange situation where if we come up with creative uses, we can go to our delegation maybe and say, is there a way they can expand the capacity of being able to use it? But or we may decide that it's worth taking a risk. And those are the choices you're
we
going to make.
did do that. We did do that with some of the housing money.
Yep.
Well,
Under
and we
under the
never
other.
used 200 million for rental assistance, I don't think.
You what?
That seems to be the feedback, unless, for example, this gets into the question, would we be able to do some retroactive substitution? So could we take the money we use CRF for rental assistance and use this, and then free up the CRF that has more flexibility? So, but the big challenge for that is there was no income test under CRF. This money comes with an income test of 80% of median income for a 12-month period. So that gets complex. But that's going to be our challenge, is to see how we might be able to free up CRF, take the flexibility that we have now without the deadline, and use it in other ways, or the extent to which we use the CRF for payroll costs for public safety and corrections, and therefore free up general fund that gives us the ultimate flexibility. So that's going to be our challenge, but I think if past history is any indication, we'll be up to it.
Yeah, and Stephanie is spending a lot of time thinking about creative uses for this money, and so she'll be able to work with you on that.
Yeah.
You know, for example, hotel vouchers and things like that. Can that qualify as rental assistance? There's a lot of programs, a lot of things you can push on.
Yeah.
Then I know that the legal aid has been wondering about people who are suffering from foreclosure, and can you argue that some of this should be used in that area? So it's a lot of good questions on this.
Mm-hmm.
The Center for Disease Control Prevention, we now have about.
Can I just back up? What's the timeline on that? Because we never sent out the rental assistance money for December because it was overcharged. So we have a bunch of people that are just sitting there.
Yeah, so this is, we were told we're getting 55% of our allotment in the Treasury this month. And then the question is, we have to have it allocated by September 30th, or we send it back to other states. So it's pretty quick, and figuring out how you use it will be, one of the quicker important things.
So I'm just saying, we've got renters that applied for December and are sitting there now, and I don't know what to tell people.
So this might be an area you bring in the agency right away to talk about this issue.
Okay.
Particularly if it's something that we could address through the BAA.
Right.
Yeah.
Right. Center for Disease Control Prevention, we're getting 8 million in vaccines, 36 million in testing. I had a brief conversation with Sarah Clark, and she could have her come in and tell you what this means. I think she thinks we're okay for the first 6 months of 2021, but there's a lot of expectation we'll get more money in subsequent bills. But we are, and this is about where you think we get in the state share. So that'll be something she needs to testify on. The school money.
Since the federal government purchased the vaccines, we're talking about the administration and the organizational costs. But
it says here mitigation. What does that mean? So that may be the window to do more if we have money to do something with.
Yeah. Mm-hmm.
The elementary secondary school relief is just to set a piece of that, and this is going to be a big issue. As you remember, when you left here, you even had a bigger problem in the ed fund, but right now it's about 58 million of a hole left over from last year. And then the 9-cent tax rate increase is roughly about a $75 million, to buy that down to level would be at 75. So between those two, you have maybe 133 million of just of desire to do stuff with. Well, the first thing is that the up until December, we're up 42 million in sales tax. So, or in ed fund rather. And so we may be up 70 million by the time next week rolls around for this year. And then the forecast for next year may be up too. We're probably looking at every time the federal government gives us money and gives us money for individuals to spend and more UI, they spend it. And, then what happens is you end up with revenues in the sales tax, especially. So we are looking at probably a pretty strong 2-year period of 21 and 22 in this area. And there's a pretty good likelihood you'll be able to cover most of that shortfall, both of those shortfalls with the federal, with the revenue upgrade. But that's something we'll know in a week or two. But then the other thing is that this money, this 127 million, 10% can stay in the state for us to allocate. And that brings it down to about 113, 14 million. And then that 114 million is really flexible money. It can go to mental health. And it doesn't say, it could go to mental health that would normally be in the AHS or the schools are related. It could go to covering environmental issues like PCBs. It could go to not just COVID, but school environmental, school construction, could go to helping low-income people.
It could go to radon.
Could go to radon. So you're going to have, you could have used that money, and you could use that money to just cover what the ed fund would have normally paid and reduce the ed fund need. So that's going to be a choice, and then lower taxes further. Or you can use that money to meet some of the needs in the education world that you haven't been able to meet. So that whole decision of what to use the money for and the new revenue for the ed fund is a big deal. You're going to have a fairly substantial chunk of money for that.
Is somebody, are you working on that, Steve?
Well,
Or-
we have, as you know, Mark's out, so Chloe and Catherine are taking the lead on that, but it's going to be, I think you're going to be doing a lot of the work on it in this committee. And Stephanie will all work on it. It's going to be there'll be a lot of people with ideas, and
I'm sure the House Ways and Means, so it
Yeah.
seems to be a driving force on their side of any
Yeah.
education allocation will influence what the House does.
Yeah. The other thing that's happening in the Senate Finance tomorrow is when we gave out the CRF money in education, part of that was given out for things that they normally could have paid for with the Ed Fund. And there's language that allows them to reduce the Ed Fund by that amount. So there may be $10 or $15 million of reduction of Ed Fund need because of that. So you have all these things that are sort of breaking in a little bit in your favor, giving you room to figure out what the next step is.
So in summary, people who are, of course, that letter that went out with the 9-cent rate increase in the rate caused a lot of consternation, but what you're rolling out is that there are a whole lot of variables at work that would end up with a very different impact and a significantly less.
Yeah.
Yet to be determined.
Yep. And that'll be your choice, is to figure out how you use it. The next one is higher education. We're projected to receive around 34 million. The initial numbers we got indicates about a little over 10 million goes to UVM. I think it's 12 to 13 million go to the state colleges, maybe a little more. There's money for every institution in the state, and in varying degrees, from the least amount of money to SIT, which is the School for International Training in Brattleboro, to money for Champlain and Norwich and all of them. So that's also on our website. We could send you that list, or Chrissy could. It's posted on the same COVID-related page.
So
that's already been determined?
Well, that's what we hear, is that the federal rules have already said who's going to get what. I thought we were going to have discretion. Again, if you'd asked me today, based on what I've seen, yes, it's been determined, but we could find out in the next few days that this wasn't locked in as much as we think it is. And the numbers may vary. So, but what we put up was the latest distribution that we have for Vermont. And I don't know, so we can go to that later if you want, but it's, so we think it's determined. Mental health, children and families, congregate meals programs. There's money about 9.5 in substance abuse and mental health, 15.4 in children, families, and congregate meals. I don't know how that's going to work. My sense is that could be done in the BAA, but that's something to talk about with the administration when you bring in Adam, where that money is going to go and what they're going to do with it. The 82 million in transportation funding is going to come through existing transportation. What I understand is it's coming through existing lines in federal transportation budget, fairly flexible lines. So you may have some flexibility to spend that. And we were told the administration is developing a proposal, and that would probably come through the transportation committees on what to do with that extra money. There's, as I mentioned before, there's little stuff, the broadband payment assistance, for example, where we don't know exactly what's going to happen with that. And it's going to be, we don't know if they're going to be a fixed amount for Vermont or whether it's just going to be, we have to apply for grants. And this is part of we're finding out as we go. So the bottom three things on that page, I just wanted to flag, is the initial estimates for federal relief from Joyce. And that's the thing that the chair mentioned has been updated, but if you want to, why don't we click on that? And I think you've all seen the earlier version, but it's not heavily changed, but we can, I don't know if it'll work by clicking on that. We'll find out. Well, I guess we won't.
I don't think so.
Yeah, and it may just require, it's hard to, oops, something just disappeared. And then the next one is NTSL description of the $900 bill, and $900 billion bill. That one is going to be, if you click on that, you'll be able to see all the things we didn't price, like the broadband and things like that. And those will have the federal numbers, but not the state numbers. And the last one is the NCSL omnibus budget, and that one you can click on like clean water and see where it'll say how much money more than the prior year, and you can sort of get it's a great source when you have your areas of bill coverage, because you can know what the agencies see in the way of more money or less money in those various subject areas. So that's the key thing there. The other things I just want to flag, as I mentioned, EF was up 42 million through December. General fund was up 110 million through December. We think that the rest, there's not a lot of reasons why the rest of the year won't be similar. So, we could see a 150 to $200 million increase in the general fund for this year. Transportation fund was running $12 million up through December. So in all cases and these numbers are not, they may bring us up to the level we were at last January. And we're talking a major upgrade. The difference is it's not permanent. It's probably a year or two. And then we'll be right back to your, the modified alligator chart, which shows us where revenues do not equal our expenditure needs. And then the question really is, when you're in a situation like that, where you're looking at a year or two of extra money, how do you use it in a way that doesn't build base, but gives you more capacity for the future?
Well, we've done that. We've done that in the past in terms of making sure that in reality, though, we had to use one time last year to build the budget, that 130 million higher revenues from the prior fiscal year. But I think your caution needs to be reinforced, and that is we have so much of this flowing in that it tends to obfuscate some of the underlying structural challenges that we've got in the budget once this all goes away. So the challenge for us is to figure out how we can, like we did before, if our sort of our guiding principles were how can we use money in such a way that we get the best long-term benefit, as well as how we can deal with some endemic problems. So I just want to restate those principles, because I think they're going to be at work as we make decisions this coming year, and the extent to which we can use one-time money to remedy, whether we're talking about underpayment of retirement to, I don't know, more permanent housing to whatever, broadband. Those are going to be some critical choices ahead.
Yeah. Now, and so the other thing, just a couple notes. One is on as we talked about, the House is doing the budget adjustment tomorrow, and you might hear from them. Then the 19th is the revenue forecast at 3 p.m. Then we know the governor's budget address has to be on or before the 26th of January. One of the things that there's an issue brief on our website about unemployment, that 75% of the unemployment are women. We're one of the highest states in the country in that respect. And it may reflect the nature of our economy, the hospitality industry and things like that. But, one of the things that this pandemic
the other thing I would point out, historically, Vermont women, the labor force participation of Vermont women is one of the highest in the nation.
Yeah, that's a good point. Yeah.
So we have two things at work: the nature of the employment, but also the high rate of labor force participation.
Yeah. So part of the question you're all going to deal with is, when you look at the old CRF money and you look at the new money, how do you fit those together to get the maximum value? But also, what are the sort of pandemic implications for us in the sense of, winners, losers? Where do you need to strengthen your economy and social service safety net? So these are all going to be things that you all are going to have to deal with in some way, shape, or form. The other big issues, just upcoming things, state colleges, you've mentioned the demands there, the pension funding you went over. Education fund, we're in this unique situation where resources seem to be coming in. How does this affect global warming? What are you going to do? There's some interesting questions about can any of these resources be used to cover, for example, somebody came up with the idea of, could we use some of the render assistance to help with weatherization, and is there a way to tie this together to meet some of your other goals. And then the broadband, obviously, and housing demand are critical. So these will all be things that you're facing. And that was pretty much, the really quick version of what I was going to go over.
All right. Well, obviously, we've got quite a bit to digest and a lot more information coming our way. And as you pointed out, the advantages, we're at the tail end, which helps because oftentimes we have more information or more revenues. There are times when being at the tail end means less, and you have to, be making tough decisions. But at least it seems that we may be in a good spot to work on this. Other questions of Steve right now, Bobby, and then Rebecca.
Yeah, I was wondering, Steve, you mentioned in the transportation fund, the revenues are coming in. Did you say within 15 million up?
Well, we're up $12 million in the first 6 months. So the question is, how does it roll out over the next 6 months? I don't know if it's going to be like as strong, but a lot of that may be strength. You might have it purchase and use as a big chunk of that. Interesting enough, where we don't really know why, the fees are pretty high, money coming in from, and is that just because, and we don't really have a handle on that. So that'll be something we're waiting to see what Tom says.
The question I have in regards to that, it's above what? Last year's?
It's above the official forecast. And
the August forecast.
Remind you that when that official forecast, remember the graph I gave out that showed that that official forecast reflected that our general fund revenues would be about $104 million less than they would have been with the forecast prior to COVID. So that's an important point, Bobby, to remember that these increases all relative to the official forecast, which reflected a major downward adjustment.
Yep. So that's really good news.
Yeah. Yeah. Well, it's in the direction we like.
Yeah.
Other comments? Yeah, Becca and then Dick. Yeah.
So, and I touched on this with you the other day, Steve, but just I want to revisit this question of the tension between our wanting to be creative and really think carefully about how we might best use these funds. And I mean, my understanding, there wasn't a whole lot of downside for other states that did get more creative than we did. Is that a fair?
Yeah, it's a really, I mean, we're in a situation where you think that we are going to, with the new administration coming in, there's probably room for risk taking and creativity, but that's going to be something you all, it'd be interesting to see how the administration views that. They've hired a fairly strict advisory group, and that is, I think you did last year was interesting. You picked out certain areas and said, we are going to do this and we're going to take the risk. And I think that same question is going to go up this time. Where do you take your risks and where do you push it? Because it may be, like you said last time, this is a state policy. We want to move forward. And so we think we need to take a risk here.
And we did that. We did that with the housing of the 23 million. We specifically said, this is a need and we can do it now and take the risk. And probably it's a very low risk and it's a need that we would have to address sooner or later. So we do have to sometimes say this is worth it. And I'm sure there'll be other times we're in that spot. A lot depends on which funding we're using and how we, move the extent to which we make it all fungible.
Yeah, and one of the things that, one of the areas which is really interesting, and this is something, a big area for your committee to think about, is we have two big waivers right now in the federal government. One is the ACO waiver and one is global commitment waiver. And those things have been to be negotiated. Well, with the new administration coming in, could you do some really aggressive, positive stuff in healthcare that shaping those waivers to mirror some of the things Biden's talked about? And the question is that something the administration is going to take a lead on? Is you take a lead on how do you think in terms of Vermont's healthcare needs? And this is again a risk issue, but how do you push that to accomplish goals that are maybe broader than what you could have done before?
Yeah, because we have stepchildren in our healthcare delivery, and I would say probably our mental health system is in that category. And there was no increase in the base funding. We have, this is just the beginning of our discussion. We're already putting Richie to sleep. He's tired, old.
Senator Sears had a.
Yes, Senator Sears.
Well, my question is really similar to Becca's, although my concern is that when you talk about flexibility, Steve, what I saw last year was expectations that we could do this, this, and this. And then, I'll use the hazard pay bill for an example. We were paralyzed, frankly. We passed the bill, I think, in May.
No,
And the money didn't get out until October because the House said, well, no, you can't do this, you can't do that. And then and I'm really worried we not repeat that mistake again. I felt so bad for those people who, it would have been nicer to give them the money in May than October. And I don't want to get into that situation again. And that's just one example of where we're not sure. So I don't know how to deal with that because we have so many committees, particularly in the other body, that have a say in everything that happens over there. And it gets really hard to do something. And I'm really concerned about one area, and that's the vaccination getting out and getting rolling as quickly as we possibly can. And I'm worried about that being slowed down by disagreements with the administration, the House and the Senate. And I hope we can, and I noticed you mentioned something about not being sure of the money there. We need to get that out there as soon as possible to the public, whichever group we're doing. And I don't, whether it's the 75 and older or, the first frontline workers, which may include childcare workers, includes teachers, etc. I just think we need to do it. And
but aren't you raising a larger, Dick? Aren't you raising? Maybe this is something leadership has been talking about. During this emergency, the legislature has given great deference to the authority that the governor, and ultimately relying on science and the commissioner of health. And to me, and we have not politicized it, we've had complaints, et cetera, but we've said we defer to the experts. And are you worried that we could in fact move away from that with vaccinations?
Yes,
And
I'm worried about
and get competing ideas
people
about
arguing about whether it's which group is next, and we get slowed down and we don't, and it appears right now that the new administration will put the bulk of the vaccine to states that are ready to go administratively. But I want to use that example that we not repeat what happened with the hazard pay. That at all costs we avoid that. That was the worst. I've never in my, well, people laugh, 29 years since starting my 29th year. I've never been more frustrated with anything that the legislature's tried to do.
Well, I will echo that. Remember, I had the.
No, I'm not blaming you or the Senate.
No.
It was, I had.
And then we had to fight to get all the companies to participate.
Right.
So it was a struggle from day one. And, I want to take this right now. I think the Senate should be really proud for what we did because we had so many advocacy groups, so many lobbyists, so many professional organizations representing all the different ways this money could be spent. And there were really no voices for the people who were right there on the grocery line or, whatever that got helped through this, or the, the LNA and the nursing homes where the risks were the highest. So I think I think to initiate a whole new program, and it was very hard to have the delay and the glitches that you've outlined, but I think that is an example of where we responded to a group of Vermonters that don't normally have a voice in the building. And to me, that's something that we need to remember as we go through this
totally
money
agree.
as well.
And everything that I've just said is no criticism of the Senate. I think we did it right. The fact is that because of inaction,
Yeah.
and
No,
questions
I
about
get your point.
what is feasible, both from the administration and the other body, the money never got out until.
Well, let me tell you, it made for nice Christmas presents.
Yes, they had a nice Christmas.
Yeah.
Well, I realize that.
Yeah. Senator Westman.
I think what Senator Sears brings up in I asked the question earlier about rental assistance. We've got people that applied for the program that was there. They ran out of money. It's sitting there. So they've frozen the money. And we've got people that applied for their December rent. If we do this all in a budget adjustment, they ran out of money. There's a number of programs that are direct aid to people that are in trouble. And if we wait until the budget adjustment and we argue over a budget adjustment till the end of March, some of these people are 4 months out. That doesn't make me very happy.
Well, we can do a mini CRF bill. That's not off the table.
Well,
once we
I'm
get,
just,
yeah.
but I think there's tiers of stuff. I think the vaccination stuff absolutely has to get out. But I think if you're behind on your electric bill, you're behind on your rent, you're behind on those basic things, we need to move that up, and we may a mini bill might be it. And then there is other things that can wait for the budget adjustment. But I think we ought to think about categorizing these things and how fast they should get out.
Well, I think we need to inventory them, because it was only last week I heard about the rental assistance being out of money. And then, so how do we know about oversubscribed? Or I have, people have said, I tried to apply for the business grant and my application just went off and I ended up not getting it. Are there, I don't have a sense of what all, if we were to do some kind of a technical correction or deal with deadlines, what is out there on that list. I don't know if that's anything, Steve, that we can get from the administration, but so that, the last thing we want to do is leave something out.
Yep.
Okay.
Yeah, and that may be another reason to bring in Adam quickly. And
okay. All right. Well, we're Thursday. Is that soon enough? Thursday afternoon?
Yep.
Okay.
If it can't be tomorrow.
Well, he's going to be in-house doing the budget adjustments.
Well, you can drop that. They're on him,
Yeah.
The only thing is they have to go before we can do anything. That's the issue. And besides, we're quite nimble when we have to be.
You know what I say about
We'll let Dick go over and deal with Mary Hooper on that one.
That would be a pleasure to deal with Mary, my good friend.
Uh-huh. Okay.
We have
Anything
worked
else?
so well together in the past on criminal justice issues.
Mhm.
So I am thrilled. I'll be happy to stand up for your agriculture programs, Bobby.
Any other questions or comments before we before we adjourn for today? Okay.
Thank you.
I just want to say welcome, Phil and Becca. Hope you've
They're probably both saying, get out of here with Sears talking all the time.
Especially since my morning was Sears talking all the time.
I was going to say, Phil's got you all day, Dick.
Yeah, I know. It's going to be painful for this year.
Yeah. Okay, then I'm going to suggest we adjourn, and hopefully we can have the an update on the state colleges, and then Thursday we will start right in with the administration. So if there are areas of spending or program issues like Senator Westman is referencing, be prepared to raise them or put them on the list with Adam, and then we'll decide whether we want to move forward with a mini bill or what's the best way to address it now that we're back in session. So we are on then tomorrow after the floor, which means that go through this again with me. We're talking about 2 to 3 if we can arrange it with the state college's update.
Yep.
Okay. And then Thursday, we will have Adam in and we'll start on that larger discussion about budget adjustment and any of these CRF sort of dangling issues.